Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. I am your host, Karen Litzy, and just a quick reminder, if you are looking to start your own private practice in physical therapy, cash-based concierge practice, whether you're looking to do it on a full-time basis or start part-time and move to full-time, then make sure you get on the wait list over at karenlitzy.com/waitlist for the Strictly Business Private Practice Mastermind. More information will be coming out this week. I just have to talk with my team to make sure we are all ready. So go over again to karenlitzy.com/waitlist and get ready to start your own practice soon. Yay, very exciting. All right, a big thank you today to Net Health for sponsoring our podcast. So Net Health wants to help you maintain strong relationships with your patients, especially during these times. They have created the Redoc Patient Portal, which provides a secure line of communication between you and your patients. You can conduct video conferencing for telehealth, have secure messaging, share documents and photos, and your patients have 24/7 access to their health information, including discharge instructions, home exercise program, and educational materials. To learn more, contact Net Health at Redoc, that's REDOC, at nethealth.com. So a huge thanks to Net Health for sponsoring today's episode. And on to today's episode. This is a long time coming. So I am so excited to have on the program Dr. Susie Gronski. She is a licensed doctor of physical therapy and a board-certified pelvic rehabilitation practitioner. Simply put, she's a doctor for everything down there. Her passion is to make you feel comfortable about taboo subjects like sex and private parts. Social stigmas aren't her thing. She provides real advice without the medical fluff, sort of like a friend who knows the lowdown down below. She is the author and creator of a unique one-on-one intensive program helping men with pelvic pain become experts in treating themselves. Her enthusiasm for male pelvic health stretches internationally, teaching healthcare providers how to feel more confident serving people with dangly bits. She's determined to make sure you know you can get help for painful ejaculation, problems with the joystick, discomfort or pain during sex, controlling your pee without needing to be embarrassed. So whatever you want to call it, penis, schlong, or ding-dong, if you've got a problem down there, she's the person to get to know. She is currently in private practice in Asheville, North Carolina, specializing in men's pelvic health. And she is also the author of the book Pelvic Pain, The Ultimate Cock Block, a no-bullshit guide for men navigating through pelvic pain. You can pre-order this book. Go to drsusieg.com, search for the book. It's pretty easy. If you're a physical therapist working with men with pelvic pain, or if you're a man with pelvic pain, go and pre-order this book. All of the links for all of this is available at our website in the show notes under this episode at podcast.healthywealthysmart.com. So, speaking of this episode, today we talk about what is chronic pelvic pain syndrome and chronic prostatitis, sociocultural barriers unique to men receiving pelvic pain care, male expectations and reservations during a pelvic health treatment session, and strategies to increase patient self-efficacy. So a big thanks to Dr. Susie Gronski and, of course, to Net Health for sponsoring today's episode, and everyone enjoy.
Hi, Susie. Welcome to the podcast. I'm happy to have you on.
Hi, Karen. Thank you so much. I'm excited to be here.
And now, as the listeners may know, I've had a lot of episodes about pelvic health, pelvic pain, but most of them were centered around female pelvic health and pelvic pain. And today, kind of excited to have you on, Susie, because today we're going to be talking about chronic pelvic pain in men. And I think this is a topic that is not spoken about a lot. I don't know if it's still considered taboo in many places. We'll talk about that today as we go through this podcast. But before we get into it, can you tell the listeners what is chronic pelvic pain syndrome or chronic prostatitis, which I don't know why I have a hard time saying that word, and I'm looking at it and still have a hard time. But anyway, that's neither here nor there. That's my problem, not yours. So go ahead and just give us, what is it?
Well, that's okay about the not able to say the word prostatitis, because it is a bit of a misnomer when we're talking about male chronic pelvic pain syndrome. So it's okay. I wish that word wasn't used as frequently anyway to describe what we're going to be talking about.
Good. All right. Makes me feel better.
Yes, no worries. So the official definition that one might read in the literature is that chronic pelvic pain syndrome or chronic prostatitis is having recurring symptoms lasting more than 3 to 6 months without a known cause or pathology. And that typically results in sexual health issues, urinary complaints, and obviously a lot of worry, to say the least. So that's the official definition of chronic pelvic pain syndrome. Now, the NIH, or the National Institute of Health, classifies, I put in bunny quotes here, prostatitis into 4 categories. And briefly, those categories are acute bacterial prostatitis, chronic bacterial prostatitis, chronic non-bacterial prostatitis, both inflammatory and non-inflammatory, which is the realm that physical therapists will work in. And then you have a category, interestingly enough, asymptomatic inflammatory prostatitis. And I think that's really important to stress, that you can have quote unquote inflammation in the prostate, but you still have individuals who are asymptomatic. So when it comes to the word prostatitis in itself, to describe male pelvic pain, I think it is a bit of a misnomer, because a lot of cases are not bacterial related or infection related. And actually, in fact, 90 to 95% are not infection related or bacterial related. So I think we need to shift from using prostatitis as the main umbrella term, because it puts the blame on the prostate when we know that's not the sole cause or what we're dealing with in the long run.
Got it. So that can be a little confusing for people, because I'm assuming if you're a man and you hear that diagnosis, prostatitis, that's got to be kind of unnerving to hear.
Right. For one, you don't know what it is.
Yeah.
It's like, what, when and I don't want to stereotype, but I think when guys really hear prostate anything, what's the first thing that might come to mind?
Cancer,
right. And so now you're freaked out, like, what's wrong with my prostate? Am I going to have cancer? We know it's, highly prevalent. And so, yeah, I think it is a bit of a misnomer in terms of when you have pain down there, especially without a known cause. That leaves the fear of, well, they must be missing something. There must be something really seriously wrong that the doctors are not just finding. So.
And what are some common symptoms? I know you mentioned a couple in the beginning there, but if you can kind of repeat those common symptoms that people may experience with chronic pelvic pain syndrome. And is pain one of them?
Yeah, right. Yes, most often it is a sensation that is not typically pleasurable. It's painful. It may or may not be associated with urinary issues. But in general, you'll have any sort of pain or discomfort in the abdominal or genital region. It could even be around the tailbone, or even pain with sitting around the sit bones, in the groin. It may or may not be associated with sexual function. So for some men, they might experience pain after ejaculation or with an erection. They might feel pain with bowel movements. It might be testicular pain. It might be pain between the scrotum and the anus, typically known as the taint area. So there's a lot of overlapping symptoms that one might have. Again, everyone's so unique, but those are some of the common themes that one might hear in the pelvic health world.
And so if you're experiencing these symptoms, let's say for more than a month, I mean, will people experience these symptoms for, let's say, a couple of weeks before they go see a doctor or go to look up their symptoms and see what's going on?
I think that varies on the person and their personality in terms of like their health and health-seeking behavior. In terms of men's health-seeking behavior, we know that when you compare it to, for example, women, uh, they don't tend to kind of seek out the help of doctors as women might do, right? And I
Mm-hmm.
think that's across the board in terms of international standards as well, in terms of the seeking behavior, health seeking behavior. um, I don't think I can have like I don't have a stat or fact around that, but
Mm-hmm.
I do think that men tend to kind of like watch and see what happens, or I think many of
Yeah.
us do. Like if you feel something, you're like, well, that'll just pass.
Right.
um so I don't know if I can answer that fully. I just know that sometimes people wait and sometimes people go right away because they're afraid or whatever the case may be.
Mm-hmm.
But I do think that the sooner that you can get reassurance for what you're experiencing in terms, and I mean reassurance from not just take these antibiotics and come back and see me in 6 weeks, it should go away reassurance, because that's typically what will happen when a guy will seek help. And I
Mm-hmm.
think one of the main barriers too is that, well, where does a guy go get help from when something like this happens? Because for
Right.
females, we have a gynecologist or a
That's right.
urogynecologist, or a woman's doctor, right? Unquotes. But guys, like I know my husband he's like, I would have no idea where to even go. Who do I seek for help for this kind of thing? And so I think when we're talking about barriers for seeking help, that's one of them, because
Mm-hmm.
guys just don't know, where do I go? And then you'll go to your primary care physician, who may or may not be familiar with chronic pelvic pain, or being able to differentiate whether it's an infection and what tests to do. A lot of times men are given antibiotics without even um, having diagnostic tests to see if there's an infection, which is
Mm-hmm.
unfortunate.
Mm-hmm.
Um, and they'll do this for several rounds too. And so I think the
Oof.
longer that happens, the more that we're making the situation worse in terms of, we know gut microbiome will play into this picture as well. It may or may not have been an infection that triggered this. We know the immune system plays a role in chronic pelvic pain. So, I think having a well-versed healthcare professional who can really help this person say, hey, this is what could be happening. We know a multifactorial and multimodal treatment approach is very helpful for what you're going through, and that these symptoms shouldn't last forever. Here, go see a pelvic therapist. But we know that's not happening.
Yeah.
Instead,
Right.
I see guys several years later or
Oh
years
boy.
later
Yeah.
before they even have an appropriate diagnosis, which I guess brings me to say that chronic pelvic pain syndrome is a diagnosis of exclusion. So before they even come see it or get a referral to see if they're lucky to get a pelvic health referral, they'll go through a lot of invasive tests, cystoscopies, colonoscopies, I mean, you name it. So I just think that by the time they do get the right care that they need for the issues that they're experiencing, they've gone down a really dark rabbit hole by that
Mm-hmm.
point.
Yeah, and that's sort of looking at, I mean, and it's not that their healthcare providers are intentionally doing them wrong.
Right.
They just don't know, right? So we're talking
Right.
about, I guess, this more traditional view of a medical process for men who are coming in having these complaints is saying, well, let's check this, and this, like you said, a diagnosis of exclusion. And then years down the road, they come to see you, and I can't imagine, forget about their physical well-being, I can't imagine their mental and emotional well-being is doing all right either. And now the pelvic physical therapist has a whole lot of comorbidities to deal with.
Absolutely. Absolutely. And with any type of persistent pain, not just chronic pelvic pain syndrome in men, but I think with any type of persistent pain, we really have to be looking at the psychological and sociological aspects of that person's experience, because at this point, now we're dealing with an emotionally driven process versus a purely nociceptive in nature.
Mm-hmm.
It may have started that, but now we're dealing with this cat yarn. I don't have cats, but I know they like to play with yarn, and you have this
Mm-hmm.
big ball of yarn
Yeah.
that you're really just taking one strand out at a time to really unravel, and everyone is so unique and very different. So yeah, I think that's where we're dropping the ball with getting quality pain care for these individuals. Number one, just getting rid of some of these barriers of a lack of education on the practitioner's perspective of what do I do in this situation? Why, do we need to have all these invasive tests done? In my opinion, I don't think we need to do that. But they're really not getting the referral to see a qualified pelvic therapists who can really rule out, biological triggers and even work with the psychological and sociological aspects of that person's experience, just to, again, calm things down and to reassure that person that things are going to be okay. And to that extent, I think this would be worth noting as well is some men do not have positive medical experiences, in that they're not being validated, they're often being dismissed, and no one's really actually looking at their genitals. To this day, I still have men say it's all about just finger in the butt, checking out the prostate, and no one's really addressing, like, take a look at my testicles, look at my penis, like, treat it like any other part of my body. And then that kind of plays into the blame and shame of one's body, and just, again, not knowing, no one's really looking at it. I want somebody to look at it to tell me I'm okay. And I think that's really being missed as well in those early encounters with medical providers. And I think that's so important.
And you had touched on it a few minutes ago, talking about not just what we see from a physical standpoint, but a socio and cultural standpoint as well. So what are some common barriers that are unique to men from a sociocultural standpoint when receiving care for chronic pelvic pain?
Well, the first one that I touched base upon, as you said, was having an outlet to get medical care. So there isn't a male gynecologist per se for men. And so I think just having a lack of that awareness of where does a guy go get help for these types of things.
Who would be the best physician, let's say, for help?
A urologist.
Okay.
A urologist, but that isn't usually the first line of the encounter. It's usually an internist or primary care physician. And sometimes it could be even other healthcare professionals, like a massage therapist or a chiropractor, an acupuncturist, who's hearing the symptoms, or men feel comfortable enough with a trusted provider that they trust to talk about even what they're going through. Because I think that brings me into the second, barrier is, I think, if I can say this, the masculine side of culture, right? Like, what should men, like, men should man up and not have these issues. And what if something is going on down there? Like, guys aren't really talking about their private parts in the locker room per se, right? And I speak, again, I'm speaking for the heterosexual male, but, like, I think it's just uncomfortable in terms of how the society that we live in to even have that conversation be brought up. So that being one of the barriers is just, we're not really talking about sexual health issues and what could go wrong, unless it's like, erectile dysfunction.
Right. Well, that's all over TV, so you can't miss that one.
Right, exactly. Here's a pill for that. We know how to fix that. You got Snoop Dogg talking about, like, male enhancement products on Pandora. So, yeah, and I think in terms of, what are the conversations that we're having around men's health, and it really comes down to what's selling and what's not selling, unfortunately. But yeah, I think that's one of the biggest barriers as well. Is just we're not talking about it. There are no outlets. There are no, taking a stand for men's health, essentially. And the second thing too, or the third thing, is when a guy has pain down there and they look it up on the internet, because that'll probably be the first thing they do.
Absolutely, Dr. Google will be first.
Right. And to get help, everything is women's health. Women's pelvic health, women's clinic, baby and mom, like things like that are coming up, where that in itself is like, wow, this is a quote unquote woman's issue, why am I having it? What does that mean for me? Because again, guys and everyone, I think, unless something is going on down there, like we really don't talk about our pelvises or like how things work, and we're not taught. We're not really taught about like, what to expect and how do things work, and that you have actually pelvic muscles down there, so, until something goes south literally, and then you have to like look things up, and there's enough of crap out there to scare anybody. And so
Absolutely.
I think again, I think Google is helpful, but it also can be harmful, because we know that nocivic anything can really shape someone's prognosis when they're seeking treatment. And you have scary forums, and you have people talking about how I'm living with this for several years. And then you have this person who's just starting to experience these symptoms, reading through these forums and looking at, it could be cancer or it could be this or that. It's like a life sentence. And that's really scary. And that, I think, is what part of the picture that takes things from acute to chronic, in my opinion.
Yeah. And, when people are involved in, and this isn't across the board, but oftentimes in those kinds of forums, it's people are writing about their experiences that have gone wrong.
Right.
Or that you said, I've been experiencing this for years, or I tried X, Y, and Z, and it was horrible. And so when you read those kind of forums, because I've gone on those, I think we, a lot of healthcare practitioners should go on some of these forums to see what's being spoken about. But I've gone on them for like chronic neck pain, and you're like, oh my goodness,
right?
This is frightening. It's really scary. And so I can't even imagine someone going on there who's experiencing, like you said, some of the symptoms that you had mentioned before. Maybe they've been experiencing these symptoms for a couple of years or a couple of weeks, and they look on these forums, they're like, holy crap.
Yeah.
Like this is what my life is going to be now.
Right.
I mean, that is really scary.
Exactly. And that, we know, doesn't matter what body part we're dealing with, tends to make the situation worse.
Yes.
Just because of that. And so I think I'm a huge proponent of, I am a huge proponent of having good information, knowledge, and, like I said, reassurance for this group of people to say, like, hey, this isn't forever. This is what you can do about it. We can really work with this. It's more common than you think. And it happens in this area just like any other part of our body. There's muscles down there, there's nerves down there, there's everyday function that happens, like pooping, peeing, having sex. All these things are quite normal. And I think just even experiencing some discomfort down there, just like you would have some back pain once in a blue moon, is not something that needs to be perpetuated, I think, for many, many years. But I think we're talking about, is that it's unfortunate because they will go down a rabbit hole of, well, we've checked everything, we've done every scan under the sun, and there's nothing that's showing up on scans. I just don't know what else I can do to help you. And then at that point, the conversation is, well, now it's all in your head. And then it's
and I'm a goner, like I'm doomed.
Yes, I'm doomed. And then again, when we talk about the interpersonal context of pain for that individual, it's, am I going to be able to have a family? If they don't have any, or be in a relationship, or to have kids, or how about my job? I have to sit for my work. I can't do that. Or what about my sport that I want to play? Does that mean I can't do that anymore? I mean, there's so many like what ifs and uncertainty. And that's one of the themes that men will talk about, of it's this uncertainty, this roller coaster ride of the symptoms that they experience. It's fine one week, and then it's terrible another week, and they just don't know what to expect because there's no rhyme or reason for their triggers. And that's really, I think that's a really hard mental, how do I say that? Like a lack of words. It's really hard mentally.
It is. Yeah. You're absolutely right. And now let's say one of these guys, they they've been having these symptoms, they've gone to their doctor, and miraculously their doctor said, you need to go see a pelvic health therapist.
Woohoo!
Right? Yay!
Yes.
The doctors know what's up. So what are some reservations men might have before seeing that pelvic health therapist? And then we'll talk a little bit from the therapist background point of view after that. But let's talk about the men's point of view first.
And on that note, we're going to take a quick break to hear from our sponsor, and we'll be right back with Susie's answers.
This episode is brought to you by Net Health, helping you maintain strong relationships with your patients. The ReDoc patient portal provides a secure line of communication between you and your patients. Conduct virtual visits and have follow-up conversations with your patients via secure messaging when it's convenient for you. Patients have 24/7 secure, on-demand access to their therapy health information without phone calls and voice messages. Video conferencing for telehealth, secure messaging, share documents and photos, and view health information and appointments. To learn more, contact them at redoc@nethealth.com.
Yeah, so the point of views that I'm going to be talking about are actually from the people that I've worked with. So I'm just reiterating or paraphrasing from their experience. But the number one thing is, what is it? Because the doctors aren't really telling them what to expect. So again, they'll go on Google and they'll find this is a woman's health issue, and why am I going here? And, again, that psychological aspects of, I guess, gender in general, of what that means for me as a person, and that experience in itself might be one reservation. This is a women's health issue. I don't want to go there. And so they might put that off, which is common as well. I think the second thing is the actual procedure of having internal work or an internal examination. And this is one message I'd like to kind of get across to people, is that you don't have to do internal work to get better. And I think there's this huge misunderstanding of pelvic therapy being it's all about moving the genitals out of the way and just going for internal work and chasing trigger points. That's not really what it should be. And in fact, I think unintentionally, of course, I think that's more harm than good, because we aren't really asking, if you ask the guy in front of you, is this something that you really like? First of all, what would be the purpose of doing internal work or even having that assessment? Why are you doing what you're doing? And number two, is that in alignment with what that person wants? Is that a goal of theirs? Is that functional for them? Why are we doing these things? Because we don't want, for me, I'm speaking for myself, I don't want to be another person to create medical trauma. I don't want to be that person that says, well, this is what you need. When in fact, they're on the table, cringing and guarding and tensing. And I think it's funny for me, it's not funny for the person on the table, but I think when therapists will say, oh, you're really tight, you're really tight. It's yeah, this is tightest I've ever seen. And I look at, I'll tell my patients, because they'll be told that. And I say, well, how did you feel on the table? Were you comfortable with what was going on? And they're like, no. And I said, well, that would, no wonder your muscles are tensing and guarding. That would happen with anyone. I'm but that doesn't mean that you're broken or that there's something wrong with you. And I think that's the message that's going across, not for every therapist, and I'm not speaking for every therapist, but it's just a theme that I see with men who come into my office who've had therapy in the past. And that's something that I think might be a huge reservation for someone seeking care as well, is having to have an internal assessment done. Although it is common, it doesn't have to happen.
And if you're doing an internal, so now let's kind of go into the pelvic health therapist point of view. So this patient comes in, they've had chronic pelvic pain for, we'll say, several months. And why might you do internal work or an internal assessment if the patient was okay with it, obviously? So
right.
what would a therapist be looking for?
So if the person is agreeing to have this done, number one, I think they want to have a thorough evaluation by a professional who works in this field. So that's reassurance. So you would do that because they're asking you to do that to rule out whatever. It's putting their mind at ease, right? Again, if that's what they so want. I think that's the first thing that we're doing. Number two, if there's like pain with bowel movement, or let's say that person's sexual preferences or pleasure has to do with anything anal, that would also be applicable in order to just map out areas of tenderness and then see if we can change that. So we're not there looking for golden nuggets or anything trigger points. We're there just to see, okay, can we change what you're feeling? And can we give that person an experience of, hey, it doesn't always have to hurt this way, and there are things that we can do to change things, and essentially giving them back a sense of control of their own body. But I like to preface that it is a very awesome teaching opportunity for the person, because you can say, well, how does it feel when somebody else touches you versus when you try to do this yourself? And right then and there during the assessment, I will actually we'll compare. I'll say, okay, I want you to touch those areas that hurt and tell me what you feel. And then I'll say, if it's okay, I'm going to do the same thing. And that might be my own individual hand. It might be hand over hand with that person's hand. It just depends on, again, their comfort level. But essentially, I'm just there to see if we can change their experience in their body and to prove that you don't have to hurt all the time and that things are changeable. So I love those moments. So that's the reason that I would do any internal work or any external work for that matter, is to see if we can change that person's experience in their body to create more safety and less danger. And so
that makes sense.
That's what I would do. So yeah, that's essentially why I do that. And it's not an hour-long treatment session of, internal work. But men do appreciate that you take the time to actually talk to them, to address their body, or this part of their body, just like any other part of their body. And that's a theme across every single man that I have worked with that came into my office. They'll say, I really appreciate how you worked with me and worked with my intimate parts of my body, but just considered it just like any other part of my body, like my nose. And they just felt like the sense of like they can feel vulnerable, they can be safe, they feel heard and validated because somebody's actually taking the time to work with them to ease their essential suffering around what it is they're experiencing. And I think that's really important.
And so if you are working with a patient with this diagnosis and they are not comfortable with internal work, because like you said, you don't have to do it. So what might be some other evaluative procedures you might do as the therapist to help this patient, like you said, feel more comfortable in their body and get a better sense of understanding of what's happening?
Mm-hmm. So the first thing is really just getting to know their story. So going back to giving them time to talk about what's going on for them. I think for men, having an outlet to be heard is really important because men don't typically kind of talk about these things. So once they know that you are accepting and you're there to offer that space for them to express themselves and the difficulty that they're going through with this, I think that's therapy right there. just to give them that opportunity. So having a supportive outlet. And the other thing is just if it's movement related, if it's an activity that they're having difficulty with, for example, sitting is a very common one. I have all sorts of like gadgets and toys in my office, and I just bring some playfulness into the conversation. I have them sit on various different surfaces to see what would be something they would actually explore. Again, I'm trying to see if we can violate the expectancy of, well, it always hurts and it's constant, I can't change anything. And so my role is really to see, can we change things? And if we can, let's do more of that. So I try to bring a little fun into it. I try to incorporate the passions, their hobbies that they've once done but have stopped since because of all this happening. Sometimes we don't even do any hands-on work or even a formal assessment. on the first day, because we're really going through the story, and we're reestablishing a sense of that person, well, a sense of what that person, who that person is, because a lot of times you lose who you are. You know, when you have pain, persistent pain, you've gone through something that's so life-changing. So I think, you know, for me and for that person is establishing, well, what would life look like? What would life look like if this were no longer a problem? Who do you want to get back to being? And so I do vision boards. I'll do some sort of visioning exercise where we can get to like the why. You know, why is this important for you? What do you want to get back to doing? How do you want to feel in your body? And then that becomes essentially the treatment plan or the plan of care. Anything that we can do to collaborate together in more of a coaching relationship to help you move forward to attain, I guess, living in a way that you see yourself living, but also a values-based type of approach in terms of treatment. So I know that was like a mouthful, but it's essentially—
No, that was great.
you know, if it's I'm doing a biopsychosocial approach, but I'm really having it being patient-centered and patient-led, and I'm just there guiding them. So for some people, it is really more of this, I need to figure out who I am. I need to, you know, start doing something. Well, we figure that out before we go on the table. Because there might be a lot of fear with that, or they might have had certain traumas associated with, you know, medical experiences that may be negative. And so there might be a lot of reservation. And I think we as therapists need to recognize that that person might say yes, like, yes, that's okay for you to do all these things, like with touch, but we should also be responsible of actually paying attention to what their body is doing, what their autonomic nervous system is doing while you're touching them. Because they might say yes. And I'm guilty of this too. I'll go for a massage and that person's touch is firmer than I'd like. And they'll ask me, you know, how's my pressure? And I'll be like, oh, it's good.
It's good.
Right?
It's good.
No problem. And yes. And that's my point. Exactly. That's what the person that you're working with is going through the same thing. And I think it takes a sort of a bit of a skill to recognize or to be more mindful of, you know what, this isn't necessary. I notice that you're sweating a little bit more, that you're tensing up more. I see your facial expressions. What are your eyebrows doing? And then I'll say, you know, we don't have to do this. I don't think this is right. You know, your body is saying one thing, and I know you know, on an intellectual level,
people want to be polite.
Yes, they want to make you happy. They want to please you. They want to make you happy. And I think part of the treatment too is giving them permission. That's self-efficacy. That's giving them a sense of agency to make that decision for themselves. Do I want, you know, I want to be able to say no. You know, and I tell them right off the bat, you know, let me know. I have a lot of tools in my toolbox. And if we try something, or you're willing to try something and it doesn't work for you, just let me know. Because there's many other things that we can do and try out. It doesn't have to be this one size fits all, which we know never works. So anyway, I guess in the long run, it just depends on the person who's sitting in front of me and they're essentially what they're telling me they need. And they'll actually, I have a very long intake form, but it's more reflective, very open-ended. And so I'll know from that of like what they're telling me. It's just awesome because you can see it. Like they actually write it out. Like, this is what I need. This is what I think is happening. Great. Well, I'm going to facilitate this process. And we have a conversation around that. So.
Yeah, and I think that's great. And I think it gives the listeners, certainly other therapists listening, of a better idea as to what a session treating a man with chronic pelvic pain might look like. And now you had mentioned self-efficacy, and we all know that as physical therapists, one of our biggest jobs is to give people a sense of self-efficacy and control over their body. So do you have any helpful strategies that you give to your patients for them to increase their self-efficacy and to be able to manage their care when you're not there?
I love that question. So, as you know, it probably depends on the person, but everything that we do together in a session, I make sure that they walk away with, well, here's what you can do for yourself. And it's really just a suggestion for them. I really want them to take it, to experience it. So for example, I might say, you know, let's do some pleasure hunting. Particularly if they've had experiences with, having an erection or participating in sexual activity that was painful. We know that it's like all it takes is one time for things not to work and for things to be bad, to have a bad experience, to be worried about the next time and the next time and the next time. And unfortunately, that's really strong for men and their, I guess, their penis function, and that's not uncommon to experience when you have pain down there. The last thing you want to do is be like, yeah, I'm ready for sex.
Right.
It's a threat. And so you're
Absolutely.
and I think it's just educating the person about, like, this is completely normal what you're going through, and it's common, and it's not forever, and let's see what we can do to start getting you to feel comfortable in your body again. And so I think just having that kind of conversation, not being afraid to ask the questions, and then asking them, well, what is it that you'd like to do or start with? Because there's so many things we can do. What is it that you think is the most important thing to start with onto your recovery? And that, like I said, that could be sensory integration. So touching one's body, touching oneself, and not being afraid. And then having a recovery plan or a flare-up plan, because we know that's common as well. So having some sort of structure around, if I experience this discomfort, well, what can I do next to help myself in this situation? Whether that's breath work, a stretch, talking to a friend, meditating, whatever it is for that person, then we kind of put that into a plan to say, okay, next time, if you try this, because you can't really, it's really hard to just, I think, apply graded exposure techniques or graded activity to sexual function, like, erections and having, orgasming or ejaculating. You can't, like, stop halfway. There's no, like, coming back from, like, once you hit that climax, and I think just letting them know that this is the process that happens in your body when you're going through, when you're having an erection and when you're ejaculating, and here's what you can do to help yourself post. So, I usually give things like recovery plan, but it's really collaborative with that person, because, everyone has their own way of living and their own lifestyle, and whether or not it depends on their relationship dynamics. And sometimes we have to have a conversation around that. And then, if any of those things are kind of coming into play, then we have to reach out to other, a network of team members to help with all those dynamics that might be contributing to that person's experience. So, like sex therapists or couples therapy or, that sort of thing. So it just, again, it depends on the person. So I actually I do want to make a comment about, you mentioned, so what is it that you give, to your clients or to your patients? I think the other thing that I want to mention is that for therapists not to be afraid to address the genitals. This is one thing that I think is still common, where female therapists will want to, I think, move male genitalia out of the way and just go to internal work. I think it's really important not to be afraid of, addressing or touching a testicle or touching their penis, because for them, it's really important that you're doing that. And then you're showing them showing them techniques or sensory integration techniques that they can do for themselves. So you don't have to do things, you're just showing them. And then you're saying, like, this is all completely normal, or not, or this is what we can work on, and having them have an experience in their own body that's completely not sexually related at all. But I think as female therapists, we're afraid of, like, well, what if they have an erection right in front of me, or like, and that does happen, that does happen. I think that's one of the reservations is, like, and speaking of reservations for the guy on the table, they're also afraid, maybe more so than you are, that they're going to have an erection. Oh my gosh, and then I'm very candid about that too. I'm like, we're touching parts of your body that have nerves and sense things, and physiological reaction may occur. No big deal. If you need some time to yourself, I'll walk out of the room, but you kind of address it before they even have a question about it, to put things at ease. So sorry, I went like on a tangent with that.
No, I think that's important.
That's really important to mention, for sure.
No, this is great. I mean, what great information. And so if you were to kind of take this conversation from, let's say, from the point of view of a man suffering from chronic pelvic pain syndrome, what would be your big takeaway for them?
Big takeaway. How can I put this in one sentence?
It could be several sentences.
So this is for pelvic pain syndrome for the man who's suffering with pelvic pain, correct?
Yes.
If I understand your question. Yes. Okay. The big takeaway would be that this doesn't have to be forever. Okay. Like that this isn't permanent, that if there is something going on down there, don't be afraid to talk about it. I know you may not be surrounded by people who are very candid about talking about poop, pee, and sex. Like, us as physical pelvic therapists anyway, we're so comfortable talking about that we forget that other people have reservations about talking about private parts. But yeah, not to be afraid to just, reach out to a professional who understands what you're going through and who can relate to you, because that doesn't have to be it doesn't have to be a lifelong sentence and a death sentence per se. You can get help for it, and there's help for this. And I guess that would be the main thing, just making, having support and having that outlet for them to just be themselves and know that they're not alone. So,
and what about to the physical therapist who, let's say if you are a pelvic health therapist, you're probably a little bit more informed about this. But what if you're not a pelvic health therapist and someone is coming to you with these symptoms? What advice would you give to them? I mean, outside of, I have someone that I could refer you to who's more well-versed in the treatment of this, but what advice would you give to the physical therapist who might be seeing a patient with chronic pelvic pain syndrome?
I think just having more knowledge about what it is and what it isn't, just as a practitioner, so that you can have a conversation with this person who's experiencing pain. Because in fact, if the person you're working with has groin pain or a tailbone pain or sits bone pain, I think just being aware of, like, there are other things that might be involved, and asking questions, really not being afraid to ask questions. Maybe you put in your questionnaire. I think it used to be, Oswestry used to have a sex question in it.
Yeah, they took it out.
Yeah, unfortunately. So get the original one.
Yeah.
Keep the original one. But yeah, just not being afraid to ask those questions, and really just asking the person, like, I know, asking permission without giving advice too, just saying, like, I know a little bit about this. It's not within my scope, but how do you feel about having a consultation with a colleague of mine who works with men or who works in this field that can really help you out, and we can really work together. I really, it's just opening up the conversation to say, hey, you're having these symptoms. There's something that we can do about it. It doesn't have to be, it doesn't have to be like, well, I don't know what to do for you.
Exactly. Yeah.
I think that's what it is. It's like, give them a resource or give them a website. There's so much free stuff out there. Like on my website, I have all sorts of like blog posts, and many others who work in this field have a lot of great literature on here's some things that you can do to just open up the conversation and what you can do to help yourself. So I think that's really the key, I think, for professionals who are not pelvic health therapists, but working with people who have pelvises.
Yeah. Yeah.
That make a difference, and they might be coming to you for low back pain, but we know that low back pain and pelvic floor dysfunction and pelvic issues are correlated, highly correlated. And in fact, a lot of testicular pain can originate because of low back issues and vice versa, because of the connection there. And so I think just having that conversation with your patient of saying, like, this is why it's all connected, and this is what I think is what else is happening. How do you feel about getting a consult from so-and-so related to this? Because that person might be having many other struggles down there, but not talking about it.
Right.
So the first and foremost thing to do from a therapeutic perspective is, let's have a conversation, because we don't know what else might be going on for that person. And we can certainly be that gatekeeper, that liaison that says, hey, I know I can get you to see so-and-so to help with these issues. You don't have to just live with them.
Yeah, great advice. Thank you so much. This was such a good conversation. I think from the standpoint of the therapist and the standpoint of a man maybe experiencing some of these chronic pelvic pain symptoms. So thank you so much. And now, last question is one that I ask everyone, and that's knowing where you are now in your life and your career. What advice would you give to yourself as a new graduate out of PT school?
There's a couple of things that I'd want to tell my young grad self. And the first one being, don't overtreat and don't pathologize what's normal. And on that note, I would definitely say, you're not using your hands to quote unquote fix people. Instead, you're using your hands to support people and hold space for them. So don't treat pain with more pain. And lastly, I would say it's not your responsibility to quote fix someone. You're there to coach them, you're there to support them and guide them through their journey, but ultimately, the less attached that you can be to their outcome, the better it is for you and for that person. So I guess that would be my pieces of advice that I would give my younger self or my new grad self.
Excellent advice. So now let's talk about what you have coming up. So you've got podcasts, books, courses. So tell the audience where they can learn about what you're doing so that they can in turn help their patients or help themselves.
Well, thank you for this opportunity to have a shameless plug here.
Of course.
I'm currently working on the second edition or revised edition of my book, Pelvic Pain: The Ultimate Cockblock, which is written for the average Joe who's suffering from pelvic pain. I have a podcast called In Your Pants that's also on YouTube. And I have several support programs for men who suffer from pelvic pain. Some are online DIY programs. Others are support programs where myself and a psychologist and sex therapist have collaborated on. And I also have a course that I teach. It's called Treating Male Pelvic Pain, a Biopsychosocial Approach. So I'm very busy. I have lots of things going on.
It's awesome, but where can we find all of it?
Oh, on my website,
yes.
drsusieg.com. Sorry, I was like, yeah, it's drsusieg.com. I'm on Instagram at drsusieg. I'm also on Facebook and Twitter, same handle.
Awesome.
Yeah.
And we'll have the links to everything at podcast.healthywealthysmart.com under this episode. So one click will take you to all of Dr. Susie's really helpful information, whether you're the person living with chronic pelvic pain syndrome or you're a health practitioner that wants to learn more. So Susie, thanks so much for coming on. This was great. And I look forward to your revised book and all the fun stuff that you have coming out. So congrats.
Thank you so much, Karen. It was a blast. Thank you so much.
You're welcome. And everyone, thanks so much for listening. Have a great couple of days and stay healthy, wealthy, and smart.
You guys, so much great information from Dr. Susie today. Thank you, thank you, thank you. And I really hope that this podcast at least raises awareness of male pelvic pain, and maybe, just maybe, some men listening may seek help. And of course, thank you to Net Health for sponsoring today's episode. Again, they want to help you maintain strong relationships with your patients, which is why they created the Redoc Patient Portal, which provides a secure line of communication between you and your patients. Conduct virtual visits and have follow-up conversations with your patients via secure messaging when it's convenient for you. Patients have 24/7 secure on-demand access to their therapy health information without phone calls and voice messages. To learn more, contact them at Redoc, REDOC, at nethealth.com.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.